Hey there, it's Dr. Apareju, your downtown digital general dentist. Today I want to talk about something that you might find interesting, and that is for patients that do suffer with some dental anxiety. Now, there's a lot of different reasons for people having dental anxiety. Sometimes it's just being in this office environment, seeing their doctor or dentist provokes anxiety. Maybe it was a bad experience as a child. Sometimes it's the smells. Sometimes it's the sounds. Sometimes it's just the environment. Sometimes it's the smell of having treatment done. For example, having a tooth being drilled on. Some people don't like that. Many people don't like the injections. The pain of that and the experience of that really freaks them out. And we totally get it. We understand all of that because we have seen patients for many, many years all day long, and we deal with this. And so one of the things that we've gotten really good at is navigating and managing those patients. There are some recommendations I will give you that may help you in particular if you are anxious about going to the dentist. So the first thing is you got to feel comfortable. So you got to like your dental team and your dentist. You got to trust them and have some rapport with them. And that's usually built on the first exam, the checkup exam, the comprehensive exam. And once treatment is booked and scheduled, there are a couple things that can help you along with that visit. Now, some patients definitely are to the point where they need some kind of external help, meaning oral sedation, it could be laughing gas, it could be a combination of those things. It could be IV sedation for those patients that have had really bad experiences. We get that, and we'd love to see you and take care of those needs. There are some patients because they have a family history or a medication history. There's different reasons. Some people just don't get numb, so they feel all the treatment, and that's not a good situation. We delve into that if we find out that's a concern for you. There are some people that do need what we call a deep sedation or a general anesthesia, meaning they need to be completely put to sleep, seen in a very specific and accredited facility to get this care. This is not your regular general dental practice, okay? You have to be seen in a specific area. Again, it's a very, very small percentage of patients that require that, but we are here to help you and assist you and get that care, whether it be down those roads. Now, there are a couple things that I do recommend for those patients that don't need any of those things I just mentioned, whether it's laughing gas, oral sedation, IV sedation, general anesthesia, whatnot. So there's a couple things you can do. One is when you come in, we will guide you and distract you. So we use some different distraction techniques chairside, and we're going to give you some very specific things to do to focus on when you come in. For example, when we are doing the injection, the numbing that we need to use on a regular basis to do dental care. The other thing you could potentially do is bring in some music. If you hate the sounds, it does help. Quite often we're going to use the rubber skirt, which is the rubber dam, that device, the raincoat's like an umbrella we put around your tooth to keep the water out of your mouth. That will help most patients feel like they're not drowning, okay? We will give you suction underneath if you need it because some people have a lot of saliva in their mouth, and that just makes things worse. It compounds the effects of being in the dental office. So we will give you some glasses that will block out those bright lights because lying on your back and looking up the ceiling, the lights are shining in your eyes. So bright lights using some dark shaded glasses can help some patients as well. But there are a few other things that we can discuss in person depending on your situation. But these are some of the basic things that we do in our practice to help our patients get the care that they need, because we see what happens when people don't get the care. It just gets worse and worse, and it snowballs, and then it's a big disaster, needing much more time in the dental chair, much more expense or investment, we always say, because it is an investment in your health. Your mouth is an investment. To smile and to have a smile for many years, 30, 40, 50 years. People are living longer until their 80s and 90s and even hundreds now. So we want your natural teeth to last you that long. And usually that's regular preventative care with the dentist and having exams done on a regular basis as well. So this is super important to maintain your oral health and preserve your dentition and your smile and your facial structure. So I hope you found some of these techniques I gave you useful or if you're mildly anxious. Now, if you're more significantly anxious, let us know, and we can talk about sedation options to get the care that you deserve. If you found this video helpful, I would appreciate a like. If you think somebody else needs to hear this, perhaps you can share it with them. If you are looking for a new dentist or dental home, we would love to see you. You can just give our team a call or go directly to our website and book online. Just hit the book now button. It's www.conceptdentalreddeer.ca. We'd love to see you, and take care. Stay well out there. Bye for now.